Examination of varicose veins, palpation. Varicose veins are palpated along the entire length. Tender and cord-like varicosity indicates thrombophlebitis. Look for pitting edema. Lower limb pulsus femoral, popliteal, posterior tibial, and dorsalis pedis are assessed. Raised temperature indicates infection. Special tests are performed for assessing the level of incompetence of valves and perforators. The Morrissey's test detects saphenofemoral incompetence. It is done in standing position. Examiner keeps a finger at the saphenofemoral junction and asks the patient to cough. Presence of fluid thrill indicates saphenofemoral incompetence. The Brody Trendelenburg test consists of Part 1 and 2. Part 1 detects saphenofemoral incompetence. In Part 1 of the test, patient is asked to lie down supine. Leg is elevated to empty the vein. Saphenofemoral junction is occluded by placing a thumb on it, and the patient is asked to stand. Thumb is released immediately. Rapid filling of veins, from above downwards, indicates saphenofemoral incompetence. Part 2 of the Brody Trendelenburg test detects the incompetence of communicating veins. The leg vein is emptied in the similar way. The pressure is maintained at the saphenofemoral junction without releasing the thumb after the patient is asked to stand up. Gradual filling of the veins after 1 minute indicates communicating veins incompetence. The multiple tourniquet test detects the exact site of incompetent perforators. The patient is asked to lie supine. Leg vein is emptied by elevating it. 3 to 5 tourniquets are applied at different levels. First at the saphenofemoral junction. Second at the middle of the thigh. Third just below the knee, and fourth at the lower third of the leg, above medial malleolus. The patient is asked to stand and veins are observed. Appearance of veins between first and second tourniquet indicate incompetent thigh perforators. Veins between second and third indicate incompetent knee perforator. And below the fourth, indicate incompetent ankle perforator. The Schwartz Test suggests the incompetence of valves in between the segment of the vein. In standing position, the long saphenous vein is tapped in the lower part of the leg, and the saphenous opening is palpated. In a positive test, a palpable impulse is felt at the saphenous opening, indicating a superficial column of blood and incompetence of valves in between segments. The modified Perthes test distinguishes valvular insufficiency between the deep and superficial veins. A tourniquet is tied tightly around the upper part of the thigh. The patient is asked to walk quickly. Distended veins indicate a blockage or DVT. Feakins Test detects defects in the deep fascia. In standing position, bulges are marked. In supine position, the leg is elevated to empty the vein. It is palpated along the marked lines. Defects in the deep fascia have a circular, buttonhole consistency. Pratts Test detects positions of leg perforators. Esmark's elastic bandage is applied from toes to the groin. A tourniquet is applied at the groin to empty the varicose veins. The elastic bandage is then taken off. It is applied from above downwards. At the position of the perforators, blowouts or varices can be seen. The Schwartz Test, or tap test, suggests incompetence of valves in between the segment of the vein. Auscultation is done to look for bruits or hum. Inguinal lymph nodes are enlarged if there is venous ulcer or infection. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.